Dr. Christian Schmaal from the Central Institute in Mannheim, who's here to speak at the Karolinska borderline seminars. Could you tell me about the brain research in borderline personality disorder? Is there something wrong with the brain in borderline personality disorder?
I think there are some things going wrong in the brain of borderline patients. There are several studies now that show that emotional regulation in the brain of patients with borderline personality disorder is going somehow wrong. So that there is an overdrive of the amygdala and a dysfunction of the prefrontal cortex, and the balance between the prefrontal cortex and the amygdala is somehow out of order, and that makes them more emotionally unstable. That leads to disturbed pain regulation, and in the consequence it also leads to cutting. That's what I believe.
Okay. And so for a patient that it is experiencing a lot of emotional distress and strong emotions and self-harm, so the explanation could be that there are some things in the brain that are not in balance. Is that right?
That is at least a part of the explanation. I think, of course, there are other points that have to be taken into consideration. That there is traumatic stress, there is sexual abuse, of course, that alters their behavior. But part of it may be related to brain dysfunction in conjunction with traumatic experience leads to things like self-injurious behavior.
And in your own research, you have been studying pain perception in borderline personality disorders. Can you tell us something about that?
Yeah, we studied pain perception and pain processing in the brain using different methods, using electric pain and thermal pain and so on. And what we consistently found is that they have strongly reduced pain sensitivity. So they feel much less pain than an average person, even under non-stressed conditions. So they are used to high amounts of pain by cutting and so, but they don't feel it. And we still have not found yet the reason for that. So if it's a genetic cause, or if it is related to traumatic experience, or maybe an overdrive of the opioid system, that's not clear yet. But what we have consistently found is that they have reduced pain sensitivity, and that is clearly connected to self-injurious behavior.
And it's not just a consequence of them getting used to cut the skin, so to speak.
That may be another explanation. That could be, and we are just in the process of finding that out by doing a longitudinal study, so follow up patients before and after therapy, and to see does pain and does self-injurious behavior change after successful therapy, and compare that to a waiting list group. That's what we are doing. I can't answer that question yet.
And for patients going through effective treatment such as dialectic behavioral therapy, do you think that changes those balances that are out of order in the brain?
I believe so. So there are some early hints, so to speak, that amygdala overdrive goes down a little bit, and also we have some preliminary findings that pain normalizes after successful therapy, but as I said, that can only be found out by a longitudinal study.
And in general, would you say that the research topic, that the research in borderline personality disorders is a growing field?
Oh, absolutely, I believe so. If you look at the number of publications in the last 5 to 10 years, the publications on the neurobiology of personality disorders and on borderline personality disorders in particular has grown steadily. And by now there are symposia at large research meetings, like at Biologic Psychiatry or at American Psychiatric Association, and meetings like your meeting here that show that the importance of research in this field.
Okay, so patients can be hopeful.
I believe so. Not only because of better research in neurobiology, but also of better treatment options. And in the combination of that, I think patients can be more hopeful than 10 years ago.
Okay, thank you very much.